My name's Emily Waugh and I'm an occupational therapist working in the new graduate rotational position at Barwon Health. I'm yet to supervise students myself, so I've used the clinical supervision skills review tool to further develop my areas that I will need to work on when I become a student supervisor. I've also used the tool to speak with an experienced occupational therapist about creating learning goals that will help further develop my skills in supervision. And I can use those learning goals to advocate for any upcoming continuing professional development educational sessions in the future. I guess at university we're not taught to be teachers, we're taught to be occupational therapists, so this tool really is a chance to go through those areas that we need to develop.
Hello, my name's Johanna Dooley. I'm a Grade 2 therapist at Barwon Health. I found the tool beneficial both for student supervision and staff supervision. So as a senior therapist, you're supervising younger staff, and I found it quite beneficial in that process to use some of those skills as well. Often you've been supervising for some time, and if you haven't done recent supervision training in the area, sometimes those skills that you are aware of tend to kind of fall off the radar. So I would really encourage senior staff to do it. I found it really beneficial to refresh some of those skills that I do have and to make sure I'm keeping them at the forefront of my mind in student supervision and also in supervising junior staff. Looking at the tool, it was quite clear to me that the preparation and planning for a student is a really important part. So making sure that you give them clear expectations, set them up from the start so they're aware of what you're expecting and what the outcomes of the placement are going to be. So I work in trauma rehab, and a learning plan for the student that's specific to the area that sets out a week-by-week plan for them so they know where they're going, what they're looking forward to and what skills are expected of them on a placement. I think the tool being based on a national framework is really beneficial because for students it means there's consistency of practice. So as a student coming through, supervisors all present things in different ways. So having a bit of a national framework so that people are coming from the same area and focusing on the same things, I think would be really beneficial to students.
My name's Nicole Shaw. I'm one of the student coordinators with the Occupational Therapy Department at Barwon Health. As student coordinators, we play a really important role in supporting the continuous professional development in terms of supervision skills for our staff. For us to be able to do this effectively, we need to know what levels of skills and confidence our staff have. The tool allows us to monitor the current levels of supervision skills that our staff have at any one time. This is a key component to the quality and accountability of our program. I think the tool provides a shared language across our department in terms of supervision, and that's really, really important. It's important our department understand some common expectations around supervision and that we as student coordinators can make some plans around providing continuous supervision and continuous professional development for our staff as well. While we're focusing around student supervision, because that's primarily our role, the feedback we're getting from staff that are more senior staff is that they are utilising this tool and identifying needs around other supervisory roles that they might play. So if they're supervising staff, they might be supervising other team members. So it has broadened its capabilities in terms of how we can use it.
I'm Nikki Lyons. I'm one of the occupational therapy student coordinators at Barwon Health. So we use the tool as a clinician self-assessment tool. We then sit down with our clinicians and identify learning goals as a result of what's been highlighted from the tool. These learning goals then become an integral part of their professional development record for the year. We can then provide graded supervisory experiences and professional development opportunities that help match their goals. So in this way, the tool has really helped us to provide targeted support to our clinicians, which of course in turn then supports our students. We initially rolled out the tool with our grade 1 staff, but the information that we gained has been so valuable that we've decided to roll it out with all staff at all levels in the OT department at Barwon Health. The tool has enabled us to provide a consistent framework to apply across the OTs in Barwon Health. Prior to using the tool, different departments were using different methods to assess levels of supervision. Consistency is key. We now have an integrated approach and we're able to target clinicians as required to ensure that we are providing quality supervision for our students. We found that the staff really like using the tool. They find it intuitive and they have appreciated the time to sit down and reflect on their supervision skills and complete the tool. We're using the tool to ensure that our clinicians are providing the best supervisory experience that they can for the students that are coming through Barwon Health in the OT department.